I recently made a video where I was sharing my first experience as an agency nurse because even though I work as a full-time NHS staff, I still work as an agency nurse. That means I do agency nursing, what is also known as travel nursing in the US or other parts of the world. So in the UK, it is called agency nursing. It is a bit different in the UK compared to other parts of the world because mainly you can go and come back. Unlike like in the US, if you're going to be a travel nurse, you go for like a 1 month, 2 month, 3 month, 4 months contract, and that is how it works. You may not be able to do your regular jobs. Here in the UK, it is not as complicated or it is not as serious as it is in the US. Before we continue, I'm going to be telling you about Skillshare. If you've been on this channel for a while, you know I've been speaking about Skillshare, and it's because I trust them. I'm back to tell you that Skillshare is still worth checking out. Recently, this past month, because before I come to you, I tried to make sure I do one class. I actually attended a class because I'm trying to go back to losing weight. If you know, some time ago, I was very consistent with trying to lose weight, but at some point, I became a backslider. So I'm trying to go back, and before I go back into weight loss and exercise, I tried to take a class with Plateau Physio on Skillshare, and I'm learning the things I'm doing right, the things I'm doing wrong, when I can eat, when I shouldn't eat, what I should eat before I go for my exercise to have better results, effective exercises to take, just so I'm not wasting my time. There are so many courses on Skillshare that will help you. Is it your craft? Is it your body? Is it your mind? Skillshare is very good. It has so many languages that you can convert to, and is in over 150 countries. Wherever country you are, from the comfort of your house, you can learn a skill. Knitting, anything, baking, cooking. You can learn a skill within the comfort of your home. And you know, the best part is the first 1,000 people to use my link, the link in my description box, to subscribe to Skillshare, we get 1 month free subscription. Try Skillshare, get it for free. This will give you time to see if you really like it. Let me know in the comment section what skill you're going to be learning, what you want to learn, or how Skillshare is. Give it a try and give me a feedback. Please remember the first 1,000 people, so you want to be as quick as you can, to go to my description box and just follow the link. Thank you, Skillshare, for sponsoring today's video. So what is agency nursing? Agency nursing basically means you working, but you're not under a specific company. That means you're working, you go to work based on how you've been chosen or how you've chosen your work, and it just differs from one agency to the other. So why should you join agency nursing? You should join agency nursing because number one, you get higher pay definitely than you get paid if you're a permanent staff somewhere. Number two, you can decide and choose your job as much as you want, when you want it. When you don't want to work, you don't need to work. Number three, the convenience of you going to a care home or to a hospital, going to one place and you don't like it, you don't need to go back. Like, I've been to some places that I've promised myself, Gloria, you are never, ever, ever going back there, except they're going to pay like, good money. So you can decide to go somewhere and decide you don't want to go back, depending on your experience there. The another thing is it gives you a bit of more confidence to say you are flexible, because if you've worked in, let's say, 3 different or 5 different places, it gives you this kind of self-confidence. Although each time you're still going to a new place, you still have this feeling of, I don't know the place, but over time you begin to be more confident, and you'll be able to be exposed to different ways of how places work. You'll be able to meet more people, and it's just a bit more broadened than if you're just working in a particular place. That's going to become your safe zone, that's going to become your comfortable zone. But if you're an agency nurse, you go from one place to the other, you meet more people. Although it can be a bit more challenging, but it helps your confidence to be able to meet more challenging situations, more medical conditions, more challenging patients, residents, and it's just a bit broader. And sometimes over the time, it gives you more confidence in yourself, and to know that yes, you can actually be flexible to change and to learn new things. What are the disadvantages? I'm still going to be telling you the requirement and all, but before we go into that, what are the disadvantages of being an agency nurse? Number one, and the most scary part is it is very unpredictable. You can go to this home today and go to the next home and you don't meet the same patient anywhere, or you don't meet the same resident. Is going to be very different from what it was where you're from. So you may have different experience, you may meet different people and different challenges. Sometimes it can be overwhelming. Another thing is, what I've noticed is, because you're an agency nurse, most of the regular staff where you're going, they already know you're getting paid higher, they already know you're getting paid more, or even 2 to 3 times more than they're getting paid for the same job. Even though they know the patient more than you, they know the resident more than you, they know the job. I'm telling you, they know things there better than you, because it's not your own area, it's not where you've been, except you'll be working there for over and over again. You may not know as much as they know. So because they know that you're getting paid more than them, sometimes they can accumulate the work for you. And sometimes if you meet somebody who don't like you, I'm telling you, you're going to be overworked. They're going to make you work and work and work, and they may even treat you like you're not part of them, you're not part of the group, you're not part of the club. But most homes I've been, I always look, once I like that home, I'll try to apply back to that home. Another disadvantage of being an agency nurse or agency carer even is that your shift may get cancelled at any time. Sometimes you pick a shift and you're already settled. You think, oh, this week I'm going to get this and this and this, and you've already calculated. You've got your expenses to pay, of course, and then all of a sudden, either the client, the home, the hospital, something can just happen and that shift may be cancelled even at the last hour. Although they shouldn't just do it to you all the time, but there are still times when your shift may be cancelled. There are times when you apply for shifts and then you don't get it. I'm going to be telling you how to go about these things, okay? I'm going to be telling you different ways to avoid these problems. And then another thing is, you may need to be mobile. If you're going to be doing agency nursing stroke travel nursing, you may need to be traveling. You will definitely need to be traveling from one location to the other. Although depending on the agency that you have joined, some agency, I even know some agency that will not allow you to work within your council. They will not allow you to work within your locality. That means you need to go out of your locality, you need to travel. So you have to be mobile most of the time to be able to be available for when the shift is available, and sometimes it can be very far from you. So that's one disadvantage. If you're not able to drive, it may be challenging for you to always take the bus. I've seen agency nurses that actually don't drive, but I just mean it's a bit more challenging. Another disadvantage is you don't get maternity pay, you don't get maternity leave. Although there's some agency that may allow you to go on maternity leave without pay, but it is work and get paid. If you don't work, you don't get paid. If you're on annual leave, if you're on maternity leave, if you decide that this month I don't want to work, nobody's going to ask you, nobody's going to question you, but know that you're not going to get paid. And another thing is, now most agency, it is actually mandatory for you to get pension. So that is good that you will get your pension with that agency, so that's not a bad thing. But then it may not be as high as if you're in a regular job, like the NHS that has good pension, things like that. And then your environment is not a stable environment. The company can fold up tomorrow, you will need to apply to another agency. So there are just few things. And again, if you're on a visa like myself, if you're on a tier 2 work visa, or you're on some visa or the other, you may have restricted hours that you can work as an agency nurse. But if you have your citizenship or indefinite leave to remain, your hours may not be affected. And of course, if you don't have your indefinite leave to remain, or you don't have your citizenship, you cannot be a full-time agency nurse or carer, because you will have to have a sponsor. And I don't know of any agency that will sponsor your visa. Okay, I don't know of any agency that wants to sponsor your visa. So you will have to have your main job, and then your agency job will just be like your part-time, which normally your part-time job should not be more than 20 hours in a week. Another thing that you may expect is to be more discriminated. You can go to somewhere and you're not going to be loved at all. I've said a little bit about this. You may face more discrimination. Unlike if it is your comfort zone, you've made friends, it is your regular work, you go there every day, you get to meet the same people, the same co-workers, your manager already know you, they already know your skill. If an agency nurse, sometimes or most of the time, you're having to prove yourself. You have to work to show that I'm a good nurse, I'm a good carer. You want to prove yourself to somebody. Another thing which is not actually a disadvantage I would say is you may get too used to the money. Just like my care homes, the care home I started when I got to the UK is the highest I've ever been paid. So from that care home, I went to another care home. And when I moved to another care home, I was losing about £2 per hour in the second care home. And then I moved from that care home to the NHS and I am losing currently from £5 to £6 per hour. So imagine you get to lose more money, and if you're getting so used to losing money, so now that I'm in the NHS, I complain about my salary all the time. In fact, that's one of the reasons why I've not come to share with you how much I get paid every month, because I'm always moaning, I'm always complaining about the salary, and it is nothing but the fact that I started on a high paying salary. So now that I'm in the NHS, I'm seeing it as if it is not normal, I'm seeing it as if it is not usual. But if you don't know any other thing, like if I started with the NHS, by now, number one, my band will have been higher, and then number two, I would have been used to the money. But now, because I'm coming from a care home or care homes where I get paid higher, it's actually a bit annoying that I'm now getting paid less. You do understand what I'm trying to say? So if you're a full-time agency, or if you're working with agency, there's a tendency that you get used to the money. The money is going to be a bit big for you, that you can get stuck in the system of wanting to work all the time, to apply for most of the shifts, not resting, and not wanting any job that will pay less. I don't think there should be any reason why you want a paying less job, but you can just get used to that money in a not so good way. So what are the requirements to become agency nurse especially? Number one, I've gotten asked so many questions. When I got to this country, I didn't understand how I can join agency nursing. I was asking so many questions. So the first thing you will need is to have worked in the UK for at least a period of 6 months. So you should have at least 6 months nursing experience in the UK to be qualified, and at least even to give yourself, the time to learn. You don't want to just jump into the country and then start running about when you don't even understand what is going on in the country, okay? So give yourself 6 months, and most agencies will not take you if you're less than 6 months. Some will even say 1 year. And then if it is a specialty, like you want to go into perioperative, whatever specialty, they expect you to have worked in that specialty for at least 1 to 2 years if you're going to be NHS agency. Do you understand? If you're going to be working with agencies that supply the NHS, most of them will tell you you should have at least 1 to 2 years work experience or 6 months. Does that make sense? You need that. And then have, of course, your visa, which that's why I said you have to have a regular job, because agencies will not want to sponsor your visa. Have a regular job that will be able to sponsor your visa. And remember, you shouldn't work more than 20 hours every week, which is your extra hour time given. But now that there's COVID, so many of those law has been relaxed. But please keep up to date and don't allow that money to entice you. Although if it's a week where you're not working, you may be able to do more. But if it is a week where you're working, remember you shouldn't do more than 20 hours extra shift. Okay, you should have a valid PIN. You should be registered with the Nursing and Midwifery Council of the UK. Have a valid PIN. If you're in the UK as a nurse, I will expect that your PIN should be valid. Remember to renew, remember to revalidate when you're due. Send direct debit so that you don't forget, because I remember my last renewal, I almost forgot. Luckily, I was given 1 month extra because I actually forgotten that I was supposed to renew beginning of the month where I got my PIN. Luckily, I was given 1 month extra. It was within the 1 month that I remembered. So from there, I just remembered and I set direct debit so that every year the money just go. I don't need to think about it, because you don't want to lose your PIN because you did not pay 120. Have a valid PIN, have a valid visa, be a resident or a citizen in the UK. Make sure you have a good reason to be in the UK, have your good job, and yes, you're allowed to join. And what you want to do is you want to now then research what is the highest paying agency, which agencies are good, because some agency, I will tell you, they are not good. Some agencies are also good. It depends on where you're living. You may tell me now to begin to list agencies. There's so many agencies that pay well. We have Tombury, we have Staff Scanner, we have Florence, we have Nursing Guild. So many agencies that I can list, but it depends on where you're living, how comfortable it is for you, and check how much they're going to be paying. Most agencies that pay well, they are usually good companies. Look at how long they've been existing. Browse where you are, which agency is closest to you. Some agency, they will use app where you can just select your shift. Like the particular agency that I'm with, you just go, we have an app. We go to the app, we select the time, then you will see the available shifts, you see the price, that's before tax, and then you see the location, how many miles away from your home. You then apply, you click on it, you apply. if you're approved, so many of you may apply for the same shift. So that is where I'm saying, if you know you're desperate for shift, apply for more than one shift, okay? And then apply to more than one agency. For me, I'm doing a part-time agency, so I don't need much work because I hardly have time to go for agency shift, because I do so many things. I work full-time, my husband also work, so I give my husband time to work as well. You understand what I'm saying? So most time I'm not that fussy. I'm only with one agency. But if you're going to making this agency thing serious, you can have more than one agency that you're with, but I would advise you don't have more than 5 6, okay? Have Don't have more than 5 6 agency, because the more you earn as well, the more your tax will be deducted. So some agency, you will have the app where you just select your shift. Some agency I've seen as well, they will send you what shift they have for the month, and then you will select. And I've seen agency that will just allocate and tell you and you cannot cancel. So some agencies are more strict, especially those ones that pay a lot. Research how much they are paying. If you even go on Google, search rates, agency paying rates in your locality. I'll just tell you to please be confident in yourself. If you're in an environment where you don't feel safe, please, it's better you don't go there, or you run away. Rest. Don't allow agency money to enter your eye. You can actually do agency full-time when you have your indefinite leave to remain or your citizenship. You can become a full-time agent where the only thing you do is just agency shift. You can decide to work any month, go on vacation, make more money. The money you get as a full-time nurse, like what I get paid with the NHS working 1 month, if I'm serious and I'm able to do full-time agency, is something I can earn within a week as an agency nurse. Yes, it's like that. Although it's not as crazy as it is in the US, where in the US it's as if they are doing money ritual when you're a travel nurse. But at least it is still very, very good. So I wish you good luck. Let me know how you're getting on. Let me know if you want to join any agency. You can chat me privately on my Instagram, and I will direct you to my agency if you want. If you're living in a place where they have the same agency. If not, I just wish you good luck in all your endeavor. Thank you so much for watching. I will see you in another video. Until then, stay safe, good luck, and bye. Please remember to subscribe to this channel. Thank you. Bye.